Hey y'all, I'm Dr. Ragan, and welcome back to CRxOWN Talks, where we clear up myths about Black health and break down the healthcare questions you wish you'd asked and the ish they should have told you. As we start in the new year, Black, healthy, and crowned. So it's a new year, new goals, new plans, new energy. Every January, we tend to talk about gyms, diets, money, and productivity. But this year, our vision boards must include our routine healthcare checkup, because routine health maintenance does not feel urgent until it is. And most of the conditions that tend to shorten our lives, especially Black folks, high blood pressure, diabetes, heart disease, and cancer, usually start quietly. They don't come in ringing an alarm, right? They sneak up on us, wait for us to ignore them, and boom, it's out of control before it even gets started. Now, apart from this being the start of the new year, this conversation matters right now because we're seeing rollbacks and ongoing legal challenges to the Affordable Care Act, aka Obamacare. Now, a lot of people don't even realize how many of those protections that were put into the original Obamacare that they are actively using. Things like coverage for preventative care, routine screenings with no copay protection, and then protection for pre-existing conditions. We've already seen issues this January with confusion with coverage, delayed appointments, higher premiums, and other out-of-pocket costs. So with these protections being weakened, people don't just lose insurance, they get a significant delay in care, delay in access to care, and money needed to pay for said care, right? And these delays are going to cost lives. So under the Affordable Care Act, things like your blood pressure checks, your diabetes screenings, your cholesterol tests, your cancer screenings were a lot easier to access. Now, things will be a little bit more difficult, so we have to be more on top of it because you don't want to wait till you're sick, right? And then by then, there are fewer options, less opportunities for you to get the needed care that you need. So if you have coverage now, I encourage you to use it. If you're eligible, enroll. If you're uninsured, ask what programs still exist that you can be a part of to figure out what you can do to make sure that you stay healthy in 2026. Now, I want to talk directly to the men. I know I've had a lot of men episodes lately, but if we're being honest, men are less likely to get routine care and more likely to die from conditions that could have been caught earlier. So deal with it. So that brings me to today's topic of prostate cancer. Recently, we've seen several Black men in the public eye announce prostate cancer diagnoses. To name a few, we've heard of Montell Jordan in the past, Charlie Wilson. Here recently, Funky Dineva is a vlogger. You can look him up. He's recently announced. Dwight Eubanks recently announced, and this is just to name a few. But prostate cancer is one of the most common cancers in men. And Black men tend to be diagnosed younger, more often, and more likely to die from it. Now, you can stop me if you heard that one before, because I feel like I said that on every one of these videos, but it's true. And not always is it about genetics, but just that we're diagnosed later. Some of that has to do with us not going in for our routine screenings, but some of it has to do with the healthcare system, right? Not offering these tests on a regular basis. So here's why screening matters. The important part is early screening matters because prostate cancer often has no symptoms. You don't tend to have any pain, no real warning signs or red flags generally. So you got to get these routine screenings done on time at a timely manner. And screening generally starts with a conversation, but it's a conversation that you can't have if you don't have access to care. Now, some of the possible symptoms that you may see when prostate cancer isn't silent is trouble starting or stopping urine. You may see a weak urine stream, a frequent urination, especially at night. You hear people say, getting up 2-3 times a night to pee. Pain or burning with urination, blood in urine or semen may be a cause, or any kind of pelvic or lower back pain that you can't explain should be something that you look into. Now, here's the kick with those why we say it's often silent. All of those could be linked to something else, right? And so a lot of times people either ignore those think that increased urination is just a part of normal aging, especially getting up at night to pee, but it's not. So whenever you have any symptoms, you want to really check in and make sure that it could be something benign or easy to treat, or it couldn't. So you want to make sure that we're not ignoring any symptoms. Now, back to the screening. So we want to address the elephant in the room, and probably the reason why most men don't get prostate cancer screening, the location of the prostate. I know in my practice, many men avoid screening, even when I talk to them about screening, because they don't want the digital rectal exam. And that's the finger test where a provider feels the prostate through the rectum. But here's what a lot of people don't know. Newer recommendations often start with a detailed health history and a simple blood test. The blood test is called a PSA, or prostate-specific antigen, and it measures this in the bloodstream. Now, an elevated PSA does not automatically mean cancer. It can be elevated for a lot of reasons. We see it elevated with infections, with inflammation, and even with recent sexual activity. But it does give us a strong starting point to work from. And in many cases, like I said, your primary care provider may just start with your history alone. A detailed health history, a discussion of symptoms that we just talked about, and a family history of risk factors. And this is important because some genetic mutations, like the BRCA mutation that you see with breast cancer, can increase prostate cancer risk in men. So if prostate cancer runs in your family, or if you know that there are BRCA mutations in your family, that information needs to be shared with your provider as well. So I say all this to say screening does not have to be scary, but avoiding it can be dangerous. This has been your Crown Check. So this year I want us to stop waiting until something is wrong. Schedule that appointment, get the labs, have the uncomfortable conversations, and really walk into this season, this new year, being healthy, Black, and crown secured. If you like this, share, like, subscribe, share with anybody that you know who needs to hear it. Subscribe to CRxOWN Talks, Crown with an X, wherever you get your podcast medicine. Yeah.